Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Minocycline Injection, exploring the various aspects of minocycline, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Minocycline Injection. Minocycline injection is an antibiotic used to treat a variety of bacterial infections. It belongs to the tetracycline class of antibiotics and is used primarily when oral administration is not feasible. The injection form is typically reserved for more severe infections or for patients who cannot take oral medication. Common uses include severe acne, respiratory tract infections, urinary tract infections, skin and soft tissue infections, certain sexually transmitted infections, meningococcal infections, and other bacterial infections resistant to first-line antibiotics. Next, dosage of minocycline injection. The dosage of minocycline injection can vary depending on the type and severity of the infection, as well as patient-specific factors such as age, weight, kidney function, and overall health. Let's discuss the general guidelines. For adults, the typical starting dose is 200 mg initially, followed by 100 mg every 12 hours. Depending on the severity of the infection, doses may be adjusted. For children over 8 years, the dosage is usually determined by weight. A common regimen is 4 mg per kilogram initially, followed by 2 mg per kg every 12 hours. For renal impairment, dosage adjustments may be necessary for patients with impaired kidney function to avoid toxicity. The injection is typically administered intravenously over 60 minutes to reduce the risk of side effects. Next, mechanism of action of minocycline injection. Minocycline works by inhibiting bacterial protein synthesis. It achieves this by binding to the 30S ribosomal subunit of susceptible bacteria, preventing the addition of amino acids to the growing peptide chain. This action effectively halts bacterial growth. Minocycline is broad-spectrum, effective against a wide range of gram-positive and gram-negative bacteria, including some strains that are resistant to other antibiotics. Next, side effects of minocycline injection. While minocycline is generally well tolerated, it can cause side effects in some patients. Common side effects include gastrointestinal, dermatologic, neurological, hepatic, renal, hematologic, and hypersensitivity reactions. Next, important advice for using minocycline injection. Ensure proper intravenous administration to avoid complications such as thrombophlebitis. Inform your healthcare provider of any known allergies, especially to tetracyclines, as allergic reactions can be severe. Regular monitoring of liver and kidney function, as well as complete blood counts, is recommended during prolonged therapy. Adequate fluid intake is necessary to prevent esophageal irritation and ulceration. Avoid excessive sunlight or artificial UV light and use sunscreen and protective clothing. Minocycline can affect fetal development and should be avoided during pregnancy unless absolutely necessary. It can also be excreted in breast milk and may affect a nursing infant. Long-term use can result in fungal or bacterial superinfection, including Clostridioides difficile-associated diarrhea. Minocycline should be used under strict medical supervision, adhering to prescribed dosages and monitoring protocols to minimize risks and maximize therapeutic efficacy. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using minocycline injection. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.